but it's gonna be a throwback to the topics that we learned in biology class during high school. But we're gonna see it in a different perspective. So, Rihanna, what do you think about amino acid?
I think amino acid is just not protein building blocks that we memorize for exams, but what they actually mean in your life is healing, health, maybe even in medicine. We all did our own digging, and there's more to it than just eat chicken, get protein, and all that stuff.
Okay, not gonna lie, I thought amino acids were just important if you're on a fitness journey or you're a bodybuilder. But I realized it's really important for so many things such as moods or hormone regulation.
Really?
Yeah.
Same, and it's wild how they are involved in healing. Like I stumbled on this article about long hair, and apparently some hospitals even give patients amino acid-rich supplements post-surgery to boost recovery time.
Wait, that actually reminds me back then. Dengue fever, it was quite viral at the moment. The physician actually reminded me of the doctor saying that I have to really keep track of my eating daily. The food that they gave in the hospital were really chickeny, a lot of beans here and there. I was quite surprised, but then to heal myself up, I had to force myself and I finished the whole meal for 3 days.
I think I have a story to share. Actually, my dad's diabetic, and last year he had a pretty bad food ulcer. So the doctor kept saying his diet has to improve for healing, of course. And I thought it just meant vitamins, but when I checked the supplement he was taking, it turns out most of them were actually amino acids, especially arginine and glutamine.
Oh.
See, this is the part we always overlook. We study these molecules in isolation, but we fail to understand that they're literally the bricks the body uses to repair itself. They play such an important and comprehensive role in our body.
And it's not even just about adults or people recovering from injuries. Did you know babies, especially premature ones, have specific amino acid requirements? Do you guys know that?
Whoa.
I had no idea.
Yeah.
It's okay, we're gonna delve deeper later. So their bodies are still learning to synthesize some of non-essential amino acids, so nutrition is crucial for their development.
Yeah, honestly, the more that we read, the more we know. Have you ever heard of anything called like tryptophan? Tryptophan, yeah. Have you?
Yes, I did actually.
Yeah, see, okay, so maybe we read it from the same website because without tryptophan, our brain could not produce serotonin. And we all know that serotonin is some kind of hormone that helps us be happy. So it actually, amino acid actually plays quite a crucial role in our hormone regulation and also our mood daily. Yeah.
That actually ties to something I read. There was this study showing how people with chronic stress or depression had low levels of certain amino acids. If that's not important, what is?
You know what, speaking of what's not important, I didn't know that non-essential amino acid doesn't mean it's not important for the body, but it just means your body can make them by itself. Unless they're under stress or maybe some sickness, then suddenly they become essential amino acids. It's like your body can't keep up with the demand.
Right, like glutamine. It's usually fine, your body can make enough. But if you're burnt or after surgery, it's not enough anymore. The demand spikes actually.
Yeah, talking about food and like surgery, like I tried being vegetarian for a week and let me tell you, it was a weird experience because although I eat beans, legumes, which is something that I read, I'm not really sure maybe, that is like quite high in amino acids, but I'm not really sure that one. So it might not be enough for my body, so I quit being a vegetarian, so now I'm following back my same diet.
Same. I was actually a vegetarian for almost a year, but I didn't actually plan my meals properly. So I thought beans and rice were enough, but turns out they're only complete when they're paired correctly. It's about combination actually. So like rice and lentils together, they give a full amino acid profile.
This is exactly why doctors pay so much attention about our diet. You know, I have my aunt who's also a doctor, yet she always asks for me and my family about diet we eat. It's not about them judging us, but it's about them making sure that all the nutritional gaps in our body are filled. Like when you said when you had only vegetables, you were lacking energy, right?
Yeah,
that's because there wasn't enough food in your diet that helps you give you the energy.
I see. Now it's all crystal clear. It's all
And not just physical stuff. Like we said earlier, it's about mental health too. If your body lacks the material to make dopamine, serotonin, melatonin, of course you will start feeling emotional like you said earlier. Am I right?
So yeah, physically, one thing that I didn't know when I was vegetarian for a few weeks was that my body showed signs that it wasn't okay. As in like my nails started being really weird. I don't know what's the term called. Can you ask your aunt about it?
You know what? You're right. We have so many patients here left hanging.
Yeah.
Let's ask my aunt, Dr. Pamela, who's all the way in Australia.
What's the actual importance of amino acids and why do we keep hearing about them in health blog and Jim Rose Instagram stories? Okay. So amino acids is actually first of all, we need to know what is amino acids, I think. So based on that, if we can know what's the definition of amino acids. So first is amino acid is something organic compound. It's something in your body that serves a building block for protein. And we know that protein is very important for our body and it gives a lot of body function, which we go on detail later. So with that, that's why amino acid is very important. So when the amino acid is very important because in further it gives you to build and repair the tissue. Okay, so all over your body tissue, it can be your muscle, can be your bone, can be your skin, can be your hair, which is all these are important. And as a medical student, I'm sure you all know when you learn anatomy and you're learning the skin and everything, what are the important of those organs to us as well. Am I right? So next is producing enzyme and hormones. So these are more like a molecular level in our body. And when they produce this is something very essential to our body. It's like enzyme, you have digestive enzyme that you require to produce, to break down your food, and then that gives the energy and goes on. And they also have a hormone. Like hormone is very wide as well. So it's depending whether it's your genitourinary organ, or you're talking about the thyroid hormone, or you're talking about the stress like cortisol and all those things. So it's variety hormone as well. And last but not least, the third function is because it has a very important in maintaining an immune system, so to fight any illness in our body.
Really good, doctor. But what happens if someone lacks amino acid in their body?
Okay. So when so it's always like when learning about medical is like back to basic. So if you already know what is amino acid, what it does, now you can kind of figure out in a layman some kind of thing like, so what will happen when you deficit, right? So since it's very important for your muscle, for your tissue and everything. So when you having the deficit, so of course your muscle is going to be very fatigued, very weak, because it's required, your muscle requires amino acids as a building block protein, but it's now is very much lacking. So you're going to have all these things. So sometimes you can have muscle wasting. So it's like, say example is one of it's like patient with stroke. When you have muscle wasting, a patient that's not has been immobilized due to some other illness or chronic problem, they can't walk. They have example, you have muscle wasting from the lower limb, so you can't walk. So when that it impacts your daily life as well. So number two is because it's also help with all the restoration of your tissues in your body. So when you're lacking of amino acid, it gives you a poor healing. It can give you some skin issues, poor healing to your body. If there's any wound or what, the wound heals very slow. So obviously it has danger to it being infected further. Number three, because it also has variety of maintaining all the structure in the body, you can have some hair loss, brittle nails, or any skin rashes, and it can impair your cognitive function, like your ability to think and talk and everything, and also your mood disturbance because it's another part of the hormone as well is involved in the mood as well. So overall, it kind of affects the whole body function to function like a normal function.
My next question is, why is the big deal when it's like the fuss about essential and non-essential amino acids? Because amino acid is what we said, isn't amino acids is just amino acid, or is there something more to it?
Yeah, so the amino acids, the one you brought up the good point, which is there is a classification that we have. So we have essential and non-essential. So we have the essential, I think 9, and non-essential is 11. Okay, so 11 type of amino acids is non-essential and 9 is essential. So what are the main difference in this is the 9, they have all the different names, see? So like 9 of the essential amino acids, they have isoleucine, leucine, lysine. There's like 9 types that which you can just Google and try. So the difference is mainly is the essential one is something the body can't produce. So when the body can't produce, these are the type of amino acids that you take in your diet or supplement if you really can't eat that much. Some people have like, example, your iron deficiency, the best iron is your meat, but some people don't take meat. So that's why vegetarian has iron deficiency and it's very common, right? So that's one of the reasons. So something like that. So if you have certain conditions that's not able you to take food with amino acids, then you take supplements. But if you can, then you take as much on in dietary. So that is your essential. When it comes to non-essential, it's something that the body can synthesize by the body from the other type of acids that you don't have to replace. How these non-essential and essentials work.
So doctor, apart from these questions, I would like to ask how amino acids actually help in healing, like post-surgery or trauma cases maybe?
So yeah, so how it has healing, like I said, when it helps with tissue repairment. So in the part of the wound, is you have different type of layer, okay? Your skin, your dermis, your epidermis layer, and then you go to subcutaneous and so on, right? So layer by layer, it all consists of tissue. So with the amino acids, and you have enough supplement of amino acid, it gives the tissue repair. So when the tissue is repaired, obviously, then you have to also have keep in your mind there can be other things that can cause delay of wound healing. Example, diabetes and so on, right? So that is another different part of it, or low immunity. So those people who are immunosuppressant, that's another issue as well. But in terms of the amino acids, definitely
deficiency is a similar thing, kind of like it delays the wound healing because of lacking of the amino acids to build up the protein, to build up the collagen to be given to the wound, and then it can close up to the layer up to the skin. Number two, when you have example surgery. So if you have surgery, you have some wound. Okay. The problem when you have surgery is sometimes you will suppress your immune due to the stress from the surgery itself. So when you are having enough amino acids, it gives you strengthens the immune system. So in that case, it will reduce the inflammation. So when it gives you enough immunity and then reduce the inflammation, and as all of us know, once the inflammation is reduced, the tissue can heal well.
Anyway, doctor, so I want to ask, do I really get amino acid supplements, or am I wasting money? I could just eat proper food.
That is a very controversial question, actually. Okay, because it depends if you because it depends on the patient. It depends on individual. There will be some people who cannot take dietary intake due to some medical conditions they have. Due to economical, due to social, due to religion. There's so many kind of barriers that we have to look, especially like in Malaysia being multicultural kind of thing. Sometimes it could be like due to cultural, these people do not eat certain things, and they do not eat some. Even nowadays, we have vegan, we have plant-based, and everything, right? So when we have this multiple thing, so we cannot say that whether we're going to waste money on supplement. So let's say if you're unable to have that, then you take it as a supplement because you need to restore the amino acids, especially the one is not synthesized by your body, kind of thing. So, but otherwise, if you can take in your dietary, and then to be good. Are you all interested to know what kind of food you think?
Very interesting.
Yeah. Okay. There we go. So in dietary, there are a few components. So one is lean meat. So chicken, turkey, fish. So just imagine how many people are going to eat turkey? It's very rare. But there's definitely chicken and fish. So it comes back to how many people does eat or like to eat chicken or fish, kind of thing, right? It's like preference and everything. Because sometimes we can just give the point that, oh, you do this, do this, do this. But at the end, how many patients are going to follow that? How many people are going to go and practice that? So at the end, it's back to their background. What is their lifestyle like? What they do. So we have to tailor accordingly. So one of the food is lean meat, legumes like lentils, chicken peas, beans, kind of thing. Next is nuts, which can have almonds, chia seeds. Next is whole grains from quinoa, brown rice, whole wheat. Nowadays, people diet don't even take any of those rice as white eggs, so yeah, kind of thing. And then dairy products, milk, egg, and also cheese. So like say, if those people, number one, who don't take this kind of dietary, and then they can go on supplement, and those people who cannot eat orally at all, there's certain patients who can't, so they can go on supplement. I would say that will benefit them to supplement the amino acid, and those who can and able to take the dietary, they can go on a natural base. It's kind of like a no right wrong answer in this.
Basically, it's personalized to everyone. There's no one right answer, right?
Yes, that is the right word. We have to personalize according to person to person, and then the treatment, everything works. It's something like we can just read in textbook, we can read, oh, this is a symptom, this is a diagnosis, this is the investigation we do, and this is the treatment, and the treatment comes can be 10, because whatever that you're doing acute management in the hospital is not same with what you're going to do at home, right? Like you have to continue for them, prevent them from coming. But let's say that is not their lifestyle. What you think going to happen is not going to happen. So you have to cater according to them, and then you advise them, then it comes. So it always a shared decision kind of thing between patient and doctor, and that will yield a better outcome rather than just going general. So it'll be nice when you go, if you feel somebody's lacking of amino acid and they're having the symptom, that you go in detail about their dietary and how they do and how their lifestyle, and then you tailor it accordingly.
I really want to know how do amino acids actually help in this treatment? Like, do they actually treat anything?
Okay. In treatment wise, okay. So I wouldn't say that there is any treatment that we give directly for certain specific diseases. But what we do is that amino acid actually helps indirectly in terms of restoration and maintenance of your tissue, of your immunity and everything, but not necessarily directly on the disease though.
I would like to ask about how are amino acids actually utilized in hospital settings? Would you like to explain it?
Okay. Yeah. There are a few used for in the hospital setting. So we talk so much about the wound. So there is some called as amino acids dressings that they have that can, I think, they'll have this kind of like the bacteria grass and those kind of things. The bacteria grass is kind of a dressing that have antibiotic. So this is a kind of a wound that have amino acids. So it gives to like absorb amino acid to that particular area to support the wound healing. So number two is the other one, like how I mentioned, is usually lacking of the amino acids with those patients who are unable to absorb nutrition. So let's say one of the medical problems, so they're not eating, or they have some problem to take solids and everything, or they maybe have gut problem. That's another common one, because your intestine is your main part to absorb and do all this stuff, right? So if that happens, so we give parenteral nutrition. So what is parenteral nutrition? Is something that we don't have to eat, but we give through intravenous. So that's how they treat in the hospital. So if let's say like the patient requires supplement, or patient is not absorbing anything much in their stomach due to the intestinal problem, so we have to give them parenteral, because that's going to help with the immune system, with the healing and everything, your cell and everything. Yeah.
That was actually really interesting. having dressings that have amino acids. Because earlier you mentioned that amino acids have skill moon, and then putting them on a dressing just makes so much sense.
Right. So it can be used
Yeah.
and also intended.
Such a simple but brilliant idea.
It's something like how nowadays just in the terms like well, for layman people to understand more, and that's how they come up with lots of things. Those kind of collagens products and everything that you just apply on the skin and those kind of stuff kind of thing. And I think medicals definitely is always evolving. Like there's new researchers, new things, and that's how they keep coming with this stuff. So yeah.
We might go slightly off track because I'm quite interested in the nutrients being supplied when the patient aren't able to digest or absorb the amino acid because they have external problems like gut problems or other nutritional problems. What was the that doctor used? I didn't quite catch it, but it was quite interesting.
Parenteral nutrition. So you give through the infrared.
Oh.
Parenteral. So parenteral is something not enteral. Like enteral is your GI tract. So this is parenteral. So which is through your vein. So example is this parenteral nutrition. Like one of it is the gut problem people, patients, and also secondly, like let's say stroke patients. So they don't eat much, or patient who have some other conditions like organs and the absorption, like they have trauma and their part of their bowel has been removed, so they could not have it. So we give nutrition through the veins. So that's why we call it parenteral nutrition.
It's crazy how the medical field always finds some solution that fits every patient.
Yeah, that's why I say science and technologies keep digging everything. So it's not only aesthetic part, but I think in terms of health and everything is evolving. And nowadays with the AI, they can even diagnose things from externally. Like you don't have to do so much of invasive procedure or invasive imaging kind of thing. Which is amazing. But it's just like being a doctor, I think another challenging part that we have to keep up with all this new updates, new news that keep changing.
So my last question is that for elderly patients, quite old, or grandfathers or grandmothers, for us to keep check. So I want to ask if does amino acids quantity or dosage needs to be changed according to age?
I don't think so that we have any exact per se vitamin D, how much micro international unit per day. It's just been it's never been like a point that you treat. Like example, sodium, right? So when you have low sodium, you'll be having this confusion, especially in elderly. I'm talking about elderly populations, but we do not have much on the amino acids in terms of the range and exact number that's causing lacking, and we don't check routinely, in healthcare or whatever setting. And when patient come, we do the basic sodium, potassium, calcium, this electrolyte, but we do not do these amino acids. But definitely, we do not. The need for elderly may require more than what the younger generation require, just because the elder people, they require more support of the muscle and the immune function. Because as you grow elder, your immune system is not as good as your young, and the response is much more different compared to the younger one, and also the muscle. Because when you go older, as you're talking about postmenopausal, these hormonal changes, it gives lack of the muscle strength and everything. And elderly people require this more so that they can maintain their lifestyle, like a basic good functional lifestyle, so to prevent them like recurrent falls. So it's like very dangerous and risky for them. So if their muscle is the lower limb is not going to be that good, and they do not have stroke, they do not have anything, and then they're just going on and falling, it's like dangerous because the implication from the fall is really bad. So in that manner, yes, you need them to have some sort of amino acid, but that's not something that we do routinely to check based on
Doctor, one last question. Earlier you mentioned about amino acid supplements, right? So is there any side effects if we take too much of amino acids?
Okay.
Supplements.
So anything excessive, in a simple words, is always dangerous. It's always toxic. Okay. So it can be as simple as sodium, simple as potassium. Okay, let's say potassium. Your potassium is already high, and you're going to take more and more and more banana, and that's the highest potassium. It's going to be high. It's going to risk your heart, kind of thing. So when you have amino acid, it's the same thing. Okay. So what are the risks? So most common is your general gastrointestinal. So that's where all your food, everything goes. So you're going to have all these symptoms like gastrointestinal disturbance. So it can be nausea, it can be vomiting, it can be diarrhea, it can be abdominal pain or stomach cramps. It can be strain, some to the kidney. So anything that is going to be taken, like where your organ have to excrete it out, right? So amino acid is one of it, is kidney. So you're going to have increase your workload, increased strain to the kidney. There'll be potential, that can have kidney damage because of that. And you could also have disrupt your other nutrients that are going to interact with the amino acid. So you can also disturb the other nutrition profile as well. So the risk is.
Right.
So I always suggest to take the moderate amount is always good rather than excessive.
So I think it's really important if someone is taking amino acid supplements that they meet up with a nutritionist, right? So they know what the body needs.
Yeah, because it have to correlate with the food and their supplement. It's like, those kind of things. If it's like in average, a nutritionist will be the best person, obviously, because they're going to coordinate with the amount of food based on your calorie intake, based on your portions, like very detailed. They are definitely expert in that. So if they can do that, they will suggest to you what are the dose that you require for your supplement per day.
I don't know about you guys, but that interview honestly opened my eyes. I used to think amino acids were just for muscles and energy and the zero stuff and all. But when she brought up primary nutrition and wound care, it suddenly felt so much bigger.
Same here. I mean, I always heard the term essential amino acids, but I never really thought about what happens when your body doesn't get enough. Like the fact deficiencies can lead to poor wound healing or even no issues. That kind of hit me.
Yeah, I totally agree with you on that, especially like the part about the slow wound healing. Someone is post-surgery or have like a healing injury, surgery. So if we lack those amino acids, they actually struggle to rebuild themselves. Yeah.
Exactly, and when you mentioned that people lack amino acids in healing, that's exactly where parenteral nutrition comes into play.
Yeah, I heard about that. She mentioned that too, right?
Yeah, she mentioned that it was really good. It explained how that when people can't eat and they lack amino acids, you can provide amino acids via using a nutritional fluid, which is pumped straight into the IV.
Yeah,
That's
it's
really
really cool. Yeah, I didn't know that such technology existed these days.
Yeah, and it actually makes total sense. I mean, when your body is already under stress, whether from trauma, surgery, or disease, you need more building blocks, not less. So if you're not getting amino acids in the normal way, doctor has to step in.
And it's not just healing skin or muscle either. She mentioned how amino acids help regulate the immune system, right?
Yeah.
That blew my mind a bit. I thought it was all vitamins and minerals doing that, but apparently, without the right amino acids, the immune system can't even respond properly.
Yeah, there's a lot of patients with chronic illnesses often need like to consume supplements because it's like additional nutrition in their body. Like she said, people with liver issues sometimes get like a specifically specialized amino acids just for them to support the cell regeneration.
It really shows how each patient gets a different set of amino acids important for them, right? Because not everyone is liking the same one.
Yeah.
So with technology, we can pinpoint exactly what the patient needs, and that's really cool. But something else I found really interesting was how amino acid deficiencies can affect older people differently. I didn't realize that healthy people could be lacking amino acids, especially in the elderly. And it's not just about muscle wasting. The doctor mentioned how poor wound healing and skin problems all tied to lack of amino acid. And when she mentioned elderly, I was thinking about grandmother. I know she eats well, but I think she may lack the proper food.
Yeah.
It's because she's been healing really slowly after a small surgery, and I wonder if it's because she's not having enough protein.
Totally, and when she mentioned about the deficiency systems like muscle wasting, weak immunity, and fatigue, it made me realize how subtle it can be at first. Like we might just feel off or constantly tired and never guess it's related to something like low amino acid level.
Yeah, and that part about brittle nails that you mentioned just now, it's actually early signs,
Oh my god.
And it's kind of scary how we actually normalize these small signs and where they could be signals that something deep.
Yeah, I was quite like my eyes were open. I was like, oh no,
Same.
I have been low on amino acids all this while. So I actually really appreciated how the doctor just didn't focus it generally. She actually tried to relate it with us. How we as students that are constantly under stress, academic pressure, not eating properly, having to skip meals due to multiple reasons, maybe money, time. Like we could easily be one of the people that are running low on this important amino acid without us actually realizing it.
You know what, you're so right. Especially during exams, we all think we're tired, we can't focus, we're feeling anxious. But if our diets are bad on top of that, and we're missing amino acids like tryptophan, it could be making things worse. It's really important that we pay attention to what our body is feeling. I think a lot of people overlook this.
Yeah, and actually I like how she kept circling back to balance. That yeah, supplements can help, but a proper diet is still the first step. Eggs, fish, legumes, even plant-based eaters can get what they need if they actually pay attention to it.
Exactly. She wasn't pushing some extreme route. It's just some kind of awareness that she's trying to give us actually in the interview. Just knowing how these little compounds, amino acids, literally run half the system in our body. Hormones, healing, brain function.
Yeah, actually, honestly, I started when we first started this podcast. I actually just thought, okay, amino acids probably something that we've learned back in high school. It's just the basics. Oh, amino acid is something that's for protein. But no, this is completely something new and very, very eye-opening experience.
I feel like the medical side of amino acids often gets overlooked. We focus so much on carbs, fats, or protein in a general way, but not how these proteins are broken down and used in our body for so many things such as wound healing, growth, repair, all of this. And now we know, without the right amino acids, those systems just slow down. Our body just lacks so many things without amino acids.
So true. I think this discussion really shows how medicine and nutrition are deeply connected, and it's not separate fields, it's one body, one system.
Yeah, and it makes you think differently about food. Like, it's not just about eating healthy in the bad sense, it's also about fueling your body with what it actually needs to heal, to function, and to thrive.
Yes, exactly, Lakshmi. I agree with you and Rihanna. So now that I think we have a deeper appreciation and understanding over this underrated amino acids, now that we understand it not just in theory but in actually life-saving treatments, it's really, really powerful.
Honestly, this episode really changed the way I think about health in general. I feel like so many people in this generation, they focus on their physical health, how they look visually, but they always ignore their internal health. The internal balance that we ignore all this while. And they like to understand that if they ignore the internal health, as a result, the external health will also be affected,
Yeah, I really lucky we get to learn from this early, because with the life we're aiming for, especially those of us going to healthcare, this kind of understanding is going to matter a lot.
Alright everyone, I think we had a very fruitful discussion today about amino acids in medicine. Now let's have a short Q&A session to test our knowledge, shall we?
Ooh, I'm excited.
Right. Okay, I'll start. My first question is, how does amino acid help manage stress from body after a long illness or maybe a surgery?
Great questions, Ash. Amino acids are vital for tissue repairment and immune system. So after a stressful event like surgery or illness, our body needs extra amino acids to rebuild the tissues and boost our immune systems. Next one for you, Rihanna. Are there any amino acids that play a key role in reducing inflammation in the body?
Yes, actually glutamine is the one that really stands out. It's usually used in medical setting to help reduce inflammation and maintain gut health, especially during intense period of stress or illness.
Oh, that makes sense. Yeah.
It shows really like knowledge.
Now Norris, can I ask, can amino acid be used to treat protein deficiencies in patients who have trouble eating?
Absolutely. If I'm not mistaken, from what I've learned this episode is that if a patient has struggle, like their own specific struggles, if they could not digest amino acid or take it in naturally, they can buy IV nutrients. Yeah. So this way it helps to prevent amino acid deficiency, which could cause or lead to things that are not good for your health, such as muscle wasting as well as weak immunity. So okay, right, last question. It's a bit of a practical question and don't get intimidated. So I'd like to ask the only male in this group. So Sarbash, what is the best way for a doctor to determine if a patient needs more amino acid in their treatment plan?
Ooh, I think I know this one. If I'm not wrong, doctors usually do blood tests to check the amino acid levels, especially if the patient's in recovery or has a condition that affects their nutrient absorption. Other than that, doctors can also look at physical signs such as muscle pain, fatigue, brittle nails, hair loss. All of these signs indicate that the person is low on amino acids and maybe require additional supplements.
You, any of us do have any brittle nails or
My intake of amino acids.
check your nails.
If something's wrong, please make sure you eat more protein, yeah?
Yeah, eat that chicken.
Anyway guys, this was such an eventful discussion today. We truly enjoyed our time with each other today and I hope that you guys learned a lot today. Thank you very much. I hope to see you on the next episode.
Thank you.
Bye.
Bye.